Hi, my name's Allison Deuce,
I'm Melissa Mitchell.
and we're going to be presenting today on an article that deals with fluidotherapy and the effects of this modality on the superficial radial nerve.
The name of the article that we chose was Effect of Fluidotherapy on Superficial Radial Nerve Conduction and Skin Temperature. It's from the Journal of Orthopedic and Sport Physical Therapy, and the authors of it were Ryan Kelly, Chris Bean, Ashley Hansford, Kathleen Westfall, John Haley, and David Greathouse.
The purpose of this study was to determine the effects of fluidotherapy on skin temperature, sensory nerve action, potential latencies, and amplitude in healthy adults. And as we mentioned previously, this study looked specifically at the focus of fluidotherapy on the superficial radial nerve.
So for methodology, there were 21 students that were volunteers from Belmont University that participated in the study. 18 of those were females and 3 were males. And there were 3 groups within the study. There were 2 experimentals. So the first experimental group would receive the traditional fluidotherapy that involved the heat as well as the tactile stimulation. In the experimental group 2, they received tactile stimulation alone. And then for the control group, they received no fluidotherapy treatment.
This study is a randomized controlled trial, and specifically it was a cross-sectional study. This is level 1 evidence due to the fact that it includes both an experimental group and a true control group that did not receive any treatment at all. Additionally, the subjects were randomly assigned to the experiment groups and the control groups, which further helps its level of evidence.
Okay, so a little more information on the study. For the inclusion criteria, the participants were needed to be between the ages of 18 and 40, and they were all students at Belmont University in Nashville, Tennessee. For the exclusion criteria, anyone that was outside of that age range of 18 to 40 years of age were not able to be in the study. If they had any type of swelling or asymmetry of their wrist, specifically their dominant hand, they were unable to be in the study. Also, if you had a medical history that included diabetes, alcohol abuse, any renal or metabolic dysfunction, peripheral neuropathies, or any heat sensitivity, and also if they were currently pregnant.
So as we've learned in many of our evidence-based research classes, there's many things that gives a study strengths and weaknesses, and this study in particular had several strengths. The first and probably most important being that these subjects were randomly placed into their groups. So for each group, whether the experiment or the control group, there was a random assignment for which the subject would be put into. The second being that there was a presence of a true control group, and that means that group did not receive any treatment at all. So they sat at the same time that the individuals were receiving their fluidotherapy with their arm inside of the machine, but they did not receive any heat or tactile stimulation. The third strength is the use of a power analysis. So this study used an analysis to know exactly how many members should be allotted into each group, which further adds to the strengths of the study. And finally, the nerve conduction investigators were blind to the group assignments of the individuals that they were working with.
As for the study limitations, the researchers used convenient sampling to recruit their subjects, and all of the participants were students from Belmont that had volunteered to be a part of the study. And the second was the narrow age range limited the generalizability of the results. So the actual participants that were in the study were only between the ages of 22 and 31, which even further narrowed it from the 18 to 40-year-old inclusion criteria.
So below is a short summary of some of the significant things that we found throughout this study. The first being that the traditional fluidotherapy, which is the combination of heat and tactile stimulation, showed a significant increase in skin temperature and nerve conduction velocity. Another thing that we found that was noted that is not a significant effect, but is important to note that the sensory nerve action potential, or SNAP, amplitude, there was no significant effect for this. So this clinical modality has shown the ability to be used and assisted in the improvement of passive range of motion, and also potentially in decreasing pain. So those were some of the significant findings from this article.
All right, for the implications for OT practice, so how can we apply this in our practice? There are multiple ways. The first, fluidotherapy can be a preparatory method that we can use in the clinic or hospital that will aid in improving the nerve conduction as well as increasing the tissue temperature of the extremity that we're working on. And by aiding in this improvement, we're allowing the client to better participate in occupations and their treatment sessions. So the increased tissue temperature is going to lead to vasodilation, which therefore leads to an increased blood flow to the extremity. And that's going to help with circulation, with movement, healing. And also there will be an increased range of motion and soft tissue extensibility due to this increased temperature. So they can better reach their range of motion goals if they're trying to get to a certain degree of range of motion for specific occupations or things they do each day. This can be a great way to get them to those levels in their therapy. And also the research showed a potential for it being beneficial for pain reduction. And if our patients are experiencing less pain, they're also going to be able to participate in the occupations that they enjoy and the things in their life that they need to each day.
So for the final portion of our presentation, we've developed an action plan to put into play the things that we have learned from this article. So the first thing is that we want to incorporate fluidotherapy into our practice once we are therapists, specifically for clients with upper extremity diagnoses that involve decreased range of motion, blood flow, and even nerve conduction deficits, and potentially the pain that we talked about before. So according to this article, fluidotherapy is going to be an appropriate modality for these patients, and we want to incorporate it into our practice. Next, we want to obtain our physical agent modality certification post-licensure so that we can practice this in the clinic and have the correct credentials that we need in order to use these modalities. The third thing is we want to do continuing education courses so that we can really make the best informed decision on what modality is the most appropriate for various client scenarios and client diagnoses. We want to be able to pick the right modality and be confident and know that we have the education and the training to back that up. And then the last thing that we found in researching fluidotherapy is there's been a significant drop-off in the amount of research that has been done, specifically regarding fluidotherapy for decreased range of motion or sensitivity. There's not been a lot of research done in the last 10 years, so we really want to be a part of doing more research to make sure that this topic is something that we continue to research so that we have evidence-based practice and things that we can apply to our OT practice. Thank you for listening to our presentation on fluidotherapy. Below are the references for this article. Bye.
Bye.